morning, everyone. Welcome to the 7th Annual Community Alliance Summit. The Community Alliance Summit, over the years, has brought together more than 1,000 people representing hundreds of diverse organizations from across Pennsylvania. My name's Lisa Tesler. I'm the Executive Director of the Pennsylvania Developmental Disabilities Council. I'm a middle-aged white woman with brown hair, some gray highlights, and blue eyes. Today, I'm wearing glasses and a blue polka-dotted top. My pronouns are she, her. The Pennsylvania Developmental Disabilities Council welcomes you to 2 days of networking, discovering alliances, and collaboration building among diverse organizations throughout Pennsylvania, led by and supporting underserved, unserved populations who experience marginalization and oppression. Oppression affects many of us for different socially constructed reasons. Ableism, racism, ethnicity, age, gender, sexual identity and orientation, disability, economics, rural, urban locations, religion, and so many more. Although our discrimination experiences may differ, we can be a valuable support and resource to each other in our struggles for equality, inclusion, and social justice. The Council believes that the skills involved in understanding disability are closely related to the skills which lead to other forms of cultural competence. We believe that disability competence cannot take place in isolation from the embrace of all human diversity. Therefore, we seek alliances with those who are excluded or dispossessed on the grounds of poverty, race, ethnicity, or sexuality. 2020 and 2021 have been stressful and traumatic for all of our communities, and it also has been transformational and motivating. So at this summit, we want to discuss and explore our theme, Recover, Rebuild, and Reform. So let's think about, what does it look like in your community to recover? How can we rebuild communities to move forward? And what reform is needed to improve the community systems? Coming together provides us the opportunity to listen, learn, and act as allies with a vision that all of us belong, all of us are valued, and all of us deserve the benefits of full participation and engagement in our communities. So I trust and hope over the next couple of days that we'll find opportunities to connect around our common needs and find relationships and opportunities to work together collectively to support one another, to make better lives for all of us and sustainable change in our communities. With that, I encourage you to go to the PADDC website, Facebook, and Twitter to connect with us and to connect with one another through the Community Alliance Summit Facebook page. And I encourage you to stay tuned for news from the Council. We are releasing our new state plan and new grant opportunities this fall. So as I transition to introduce you to our keynote speaker, I wanted to cover a couple of housekeeping details. So as you're participating in this summit, we want to make sure that you can ask questions and engage with our presenters. So please use the Q&A function and the chat function throughout the session to post a comment or ask a question to the speaker. Dr. German will be leaving space at the end of his presentation in order to have discussion with you. So if you would like to raise your hand, you can also use the raise your hand function at the bottom of your screen. Closed captioning is available, so please click on your left to access the closed captioning feature. And as you can see, we have ASL running for the entire length of the presentation this morning and throughout the conference. So with that, I would like to introduce you to our keynote speaker to kick off these 2 days together. I first learned from Dr. German at a presentation that he offered around the intersection and relationship between poverty and trauma. And I knew that his experience, perspective, and knowledge would be essential in helping to build an understanding of how we could, as a community, meet the challenges we face together. Dr. German got his start working with at-risk youth in places like Camden, Newark, and Atlantic City over 30 years ago. He has a bachelor's degree from Rowan University and master's and doctoral degrees from Lancaster Theological Seminary. His career has included work with people with intellectual disabilities, providing healthcare at rural and urban federally qualified health centers, and doing community organizing and anti-poverty work. In December 2019, Dan began serving as the first executive director of Governor Wolf's new Office of Advocacy and Reform, where his focus is to create better outcomes for all people whose circumstances have made them vulnerable. In addition to his volunteer roles in the community, Dr. German is also an adjunct professor and guest lecturer at Penn State Hershey Department of Public Health Sciences, as well as an adjunct professor at the Lancaster Theological Seminary, where he co-taught a course on the intersection between theology and poverty. So I turn it over to Dr. German to kick off the 2021 Community Alliance Summit. Welcome.
Thank you so much, Lisa. Good morning, everyone. It is such a pleasure to be with you this morning. My name is Dan Jorman. I am the Executive Director of the PA Office of Advocacy and Reform in the Office of Governor Tom Wolf. As Lisa was doing her introduction, I was tempted to tell you all that I am a fit 30-year-old with a full, thick head of hair. But unfortunately, I am a bald 51-year-old who's kind of pudgy these days. So that's who I am. I'm wearing a blue dress shirt today, and I have my glasses on as my bifocal, so I can see the screen. And it's such a pleasure to be with you all. I first learned about the Office of Advocacy and Reform from a friend who gave me the job description in October of 2019. The position was created by Governor Wolf in July of 2019 with a mandate to better serve vulnerable populations across the Commonwealth and also to make Pennsylvania a trauma-informed state. And it was that second part that got me really excited. I've been serving vulnerable populations my whole career, and every vulnerable population that you can think of. And that part, I knew that was in my bones, but this idea of making the entire Commonwealth trauma-informed was something different, something new. And for me, throughout my career, serving people with intellectual disabilities, seniors, at-risk children, people living in poverty, one of the themes that I would see over and over again was trauma. And along with that, chronic and toxic stress. And so more and more through my career, I was spending time, as Lisa shared this morning, helping people see the intersection of these forces. How does trauma and how do chronic and toxic stress feed into poverty? And when we decontextualize that, so often we say, well, that's the person, it's their behavior, it's their culture. In my time working with people with intellectual disabilities, we would say, well, that's their disability. And my experience has been the opposite, that context means so much for being better at our jobs, for helping people who've been traumatized heal, and for not re-traumatizing them when we're really trying to help. And so I got very excited. I applied for the job and was hired, started in December of 2019, and wanted to get right to work on this idea of becoming a trauma-informed state. And so for me, that meant reaching out to experts. I didn't want to do this by myself. I'm a collaborative person. I was a community organizer. I feel like every person I have ever met in my entire life knows something that I don't know. And so pulling people together who have other perspectives from other parts of the Commonwealth, from different disciplines and sectors, that was really important to me in being able to put together a plan to become trauma informed that could last. And so I put out the call in January of 2020, hoping that I'd find 10 trauma experts who would be willing to work for free. This was volunteer, who would be willing to send me their resume for this free job and go through an interview process. And I thought, well, we'll see who I get. I hope I get 10 people. 10 would be great. And I got 68 people who applied to be a part of this think tank. And I'm not kidding when I say that all of them could have served on a trauma think tank. So I both increased the size of the group from 10 to 25, but also then had to tell 43 people I didn't have room for them and ask them if maybe they'd stick around and come back when we finished writing the plan to help us implement. And most of them, to their credit, did exactly that. So we got to work. I started interviewing people from all over the Commonwealth, and then right in the middle of my interviews, COVID-19 hit. And I remember very clearly on a Friday afternoon being told, hey, Monday, come in and pack up your stuff, and you're going to work from home for a couple of weeks. Well, here I sit, and if you can see my background, you can see that I'm sitting in the spare bedroom / home office of my house, where I've been running the Office of Advocacy and Reform since March of 2020. I completed the interviews from here, talked to wonderful people from all over the state, but we got started shortly after that in April. We started meeting and putting together what we thought a trauma-informed PA plan should look like. We finished the plan at the end of June of 2020, and in July of 2020, Governor Wolf approved the plan. And then we got right to work putting together an implementation team. We decided to call this team of volunteers Healed PA, and we broke into action teams and have been working since our orientation with them in October of 2020 on implementing the plan, doing the hard work, not just from a top-down plan. This isn't something that's focused on just the governor saying this should happen, but a grassroots plan of how do we, from the governor's office, support all of those regular everyday folks who are doing the work every day, or survivors of trauma, who are trying to help other people understand what they've been through. And so that's where we've been since October of 2020, digging into the work with about 150 volunteers from across the state, trying to come up with how we get each recommendation from the plan across the finish line. Today, I really want to, first of all, explain to you, if you haven't done any research on trauma and adverse childhood experiences, chronic and toxic stress, I want to give you a very brief primer on what it is that I'm talking about. And then I'm going to share some stories with you from my career in working with people with intellectual disabilities that I hope will illustrate for you where I see this intersection and how I think it should inform how we relate to each other. And how we connect with people who are not only vulnerable, but have been marginalized and traumatized, sometimes by people who mean to help. So I guess the best place for me to start with trying to explain trauma and chronic stress is just how we're all feeling right now. This might have been a harder description or conversation before the pandemic, but now I would argue that every single American, every single Pennsylvanian is experiencing at least chronic stress, if not full-blown trauma, as a result of not just the pandemic over the last year and a half, but the pandemic layered on top of the murder of George Floyd and the racial justice issues that are part of an open wound for this country for the last 400 years plus. The political unrest of that year and a half, that election year and January 6th, and the kind of homegrown terror alerts that we know are still out there today. In the midst of this, the Delta surge has given a whole lot of people who saw the end of this coming some bad news, combined with sending our kids back to school. I have 3 kids, school age. One is starting high school, 2 in middle school. One of them is 11 and has no access to the vaccine. and we're going back to a school that is not mandating mask wearing. So, all of these things are constant stressors. So when I say chronic stress, I don't mean the kind of stress when you say, boy, I had a stressful day at work today, and you come home and you try and blow that stress off and you move on. When I say chronic stress or toxic stress, when we're talking about children, I'm talking about stressors that don't go away. No matter what you're doing, they're still out there. And so for me in my career doing anti-poverty work, this was poverty, right? This was parents who didn't know how they were going to feed their children that day, or didn't know if they'd still have a roof over their head tomorrow. Those stressors, living in a dangerous neighborhood where you were constantly worried about leaving your home. We've seen that, frankly, with Asian Americans right now, and I've heard from Asian Americans who've been afraid to leave their home to get vaccinated because of all the violence against Asian Americans happening. These are what I mean by chronic and toxic stresses. It's almost like you're simmering in them. They're all around you, and it's this constant pressure. The symptoms of that are a long list of things that don't make you feel good. Things like not being able to kind of gather your thoughts, sort of a fog, sleeplessness, headaches, irritability, things that frankly don't make you your best self. I don't know about all of you who are listening, but I am not as good a speaker right now. I'm not as good an employee, a spouse or partner. I'm not as good a parent right now as I was before all of this was happening at the same time. And so, two things to understand is this is all of us. When horrible things happen to you, it's okay not to be okay. And so I want you to hear that. The other thing that I want you to understand is that this is what a lot of people were feeling long before we ever heard of COVID-19. People who've been marginalized, people with intellectual and physical disabilities, minority populations, people living in poverty. So many people already felt these symptoms and felt them every day of every year before 2020. And so I'm hoping there's a moment of empathy for all of us to understand how we're feeling as our brains respond to what is clearly too much stress. And those folks who have been feeling that for a long time. What I'll say in terms of trauma is something we experience from an event or a series of events that we find as dangerous, threatening physically, emotionally, to our lives in some cases. Those traumas, no two people respond to them in the same way. We really respond based on our resources and our level of resilience before the trauma happened to us. And so no two people will respond the same way, and no two efforts to heal will look exactly the same for different people. And so traumas have profound effects on our ability to function. They can affect our behavioral health and our physical health. And a lot of what we're talking about right now from the governor's office is making sure everyone understands that our behavioral health and our physical health aren't separate. These are combined, and so our behavioral health, these stresses, these traumas that we experience, can show up in our physical health. They show up in our bodies. And there's a great book called "The Body Keeps the Score" that talks about this phenomenon. So why does all this happen? Why do we feel so bad when we're immersed in chronic stresses and traumas? Well, a lot of it is our brain's survival mechanism. And so there are some psychiatrists and others who are starting to say that a lot of what we call behavioral health disorders aren't disorders at all. They're actually the normal response of a healthy brain to horrible circumstances. And our brains struggle to compensate for these things that we just weren't meant to deal with, like stresses that just won't stop, or dangers like child abuse or domestic violence that come at us day after day after day. And so essentially, if we think about something like our fight, flight, or freeze response, our brain stems, our amygdala is there to protect us if we're attacked by a wild animal, something dangerous happens. And what happens is it shuts down the frontal lobe of our brain. It shuts down the part of the brain that's in charge of things like emotional regulation, problem solving, critical thinking, things that we would need in a civilized society day after day. those things get shut down by the brainstem when we're in danger, or the stressors are too much, or when our basic needs are not being met. And so as we've advanced into the 21st century, science has shown us what's actually happening inside the brain. We've been able to take brain scans. We've been able to study these phenomenon and have found some amazing things. So for instance, the Adverse Childhood Experiences study from the mid-1990s, that was done by Kaiser Permanente and the Centers for Disease Control. And what they found was that if people experienced a list of 10 different adverse childhood experiences, different abuses, neglects, household dysfunctions, that those could follow them with negative outcomes long into adulthood. Things you might expect, like substance abuse, suicidality, behavioral health concerns, depression, but also things that doctors and scientists didn't expect, like heart disease, strokes, cancers, and not just cancers from behaviors like smoking, but all sorts of cancers that have nothing to do with behaviors were increased for people who had more adverse childhood experiences out of that list of 10 that was originally put together in the study. In addition to that, in the mid 2010s, early 2010s, Philadelphia did another ACEs study, this time on a much more urban and diverse audience in Philadelphia. The original ACEs study was done mostly on middle class and upper middle class and white patients. And so they wanted to look at a more diverse audience. And what they found was that not only were some adverse childhood experiences like child abuse and neglect much higher within that population, but they also found 5 additional adverse childhood experiences, which included things like being discriminated against, experiencing that racism or discrimination through an extended period of time, and things like living in a dangerous neighborhood, but also being in a congregate or residential setting like foster care was an adverse childhood experience. And so how many times have we tried to help children by putting them in these residential settings without recognizing that even if we were taking them out of something more dangerous, it was still traumatic to go into that setting. So lots of eye-opening data and research. We also have found through brain science scarcity science. So understanding that if you don't have enough to eat or drink, if your basic needs are not being met, that your brain literally won't let you focus on anything else until you get those needs met. And some scientists have found that IQ can go down as much as 10 points when you're not getting enough to eat, or you're missing other basic needs, and it can go up again by as much as 10 points when you get those needs met again. And so just profound effects on our abilities to succeed. So when you think about children who go to school hungry, or employees who go to work hungry, what that means in terms of their ability to thrive. So big discoveries around all of this, kind of showing us how profound an impact that all of this has. In fact, if a person has 6 or more adverse childhood experiences from the original list, the Centers for Disease Control says that on average their life expectancy is 20 years less than someone who has no adverse childhood experiences. It's that profound a difference. And so when we see things like dramatic differences in life expectancy for people living below the poverty line, these things start to add up. We can connect the dots and see the impact of this. I should say, in full disclosure, I'm an 8 on that original ACEs survey. So I've experienced 8 of those adverse childhood experiences, and I've experienced some from the Philadelphia list as well. And so we have to recognize what this does to people, to live through these experiences and not get healing. And there is healing out there. There are lots of proven trauma therapies that have been shown to heal people. There's a lot of work and research going on into other pharmaceuticals besides ones that just mask the symptoms that could actually help people heal. And so far heal with duration. We haven't had enough time with some of these to say permanently, but to have really profound effects, like, for instance, people who walk out of certain therapies symptom-free from PTSD without side effects, and that's a big deal. So that it's an exciting time to be in this pioneering field of looking at trauma and chronic and toxic stress. to illustrate how all of this information ties over to working with people with intellectual disabilities or living with people with intellectual disabilities if you have a family member with a diagnosis, as I do. I'm going to share 5 stories with you. The stories are going to be a story of a camp, a group home, an after-school program, an IEP, and a life. And so I'll start with a camp. And this was my first experience working with people with intellectual disabilities. I had just graduated from college with my bachelor's degree. And I have a bachelor's degree in English literature. So what that basically means is I was unemployable. And there wasn't a great economy when I graduated from college with my wonderful English lit degree. I wasn't certified to teach. I had worked with at-risk youth in a summer camp and didn't have much other work experience to draw on, some construction work and things like that. And so I was looking for something permanent, couldn't find it, and I ended up getting a job at a summer camp for children and adults with intellectual disabilities. And this was in New Jersey in 1997. And so a different world. Most of the people that were coming to our summer camp were coming straight out of institutions. So literally out of large institutions where everything was sort of regulated every day for folks, to this open air 6-acre summer camp in cabins for an overnight camp. And I got a job as the program director. So I was in charge of activities. And again, had no experience with people with intellectual disabilities or physical disabilities. And so that actually turned out to be my strength, because I had worked in summer camp in high school for kids who were living in poverty in at-risk neighborhoods and loved it. I had never treated those kids any differently. I was one of those kids. I grew up with a single mom, receiving welfare for part of her child rearing years. We had been homeless for a while. I didn't look down on those kids when I was part of that camp, and they were wonderful. And so as I came into this new job with this new summer camp, I didn't approach it any differently than I would for anyone who wanted a summer camp experience. Nobody kind of pushed me out of that mindset to think that everybody deserves the same summer camp experience. And so I worked with our new counselors on modifying some activities like a kickball game. What does that look like for somebody in a wheelchair? What does that look like for somebody who maybe isn't going to follow the instructions and is nonverbal? Like all these different adaptations. But it was a wonderful experience. And what we found was that having someone come into this who didn't know any better and just lucked into treating people like normal human beings would have this profound effect on how well the camp went that summer. And so that kind of shaped how I moved forward from there. So the next job I found, because of my summer camp experience, I found a job establishing a group home. At that point, had moved to Lancaster, Pennsylvania, and was given a job to find and create a new group home for 3 men with intellectual disabilities. And my goal, again, was just to make it home. I really wanted it to be a great place for these men to live, and wanted their input on how the place looked. I wanted it to feel like home. I didn't want it to feel like an institution in any way, shape, or form. Did things like personally painted walls, and so I think some of my blood was in that building by the time we opened it from missing a nail with a hammer. But we put it together, and the men moved into this home, and I was so proud of it. And then it came time for licensing, and the state came out to license. And honestly, my supervisor was all over me for weeks about, check all the light bulbs and make sure the paperwork is all completed, and go through every log and make sure this and that and the other thing. And it was a lot, and it was very stressful. But I was so excited for the licensing folks to come in and see this home and meet these men. And I was young and naive. At the time, I was 28. And the licensing folks came in and they checked those light bulbs, and they made sure the stove worked, and they looked at stair treads on the back deck, and they looked at the paperwork and the med logs, and they didn't spend a single minute talking to the 3 men who lived in that home. Didn't spend a minute. Didn't ask them if they liked it there. Didn't ask them if they were well. Didn't ask them if I was a jerk. They didn't ask them anything, which told me that they didn't matter to the system. It was immaterial what they thought. It was so disheartening. I didn't last long after that. I was just crushed by the idea that that's how it was. So fast forward, my next job in the field was running an after-school program, which had come out of me running another summer camp while I was working on my master's degree at the seminary. And this after-school program came about, frankly, because the county was being sued because there were no programs for teenagers. And so we started doing this after-school program. And again, I hope you can hear how my thought processes have been shaped around how I approach this work. So we started the after-school program, and before long, supports coordinators are coming to us and saying, hey, I've got this person, the diagnosis is autism, and they're hitting people in every other program that they're in. They're going to get kicked out of their programs. Can we send them to your after-school program? And the reason that they were sending people who were physically aggressive to our after-school program is that what we were finding was that people who were very aggressive in other programs had no incidences within our after-school program, literally none. And so, people were asking, what are you doing? Like, how are you doing this? And we'd have people come in and observe, and we'd get referrals all the time. And we became known as this program where if you have a child who has autism and is aggressive or is just aggressive, you can send them to this program. So what was the magic that we did? We assumed that they were high school students. I'm gonna let that sit for a second. We assumed that they were high school students. And we thought back to what we had done in high school, after school. And when I was a teenager, I hung out with my friends. I played video games. I took a walk. I'd hang out in the woods and walk around with friends. I would go to the mall. I would do different things that were just fun to me, and it was up to me. And so the magic ingredient in our after-school program was literally to ask the students, what would you like to do today? And then we'd facilitate them doing that. And we had lots of just normal high school things for them to do. And suddenly these behaviors that had been attributed to their autism or their diagnosis vanished, which proved that the issue wasn't them, it was us. It was our programming. It was what we offered. And for people who are nonverbal, there are only so many ways that they can tell us that they hate what we're forcing them to do. One of them is non-compliance or non-participation is another, and then aggression finally. If you just won't figure out that I don't want to do this, it's all I've got left if I don't have the words. And there was no need for that aggression when we took away that mindset of, well, here's the things that you can do today. It's what we've said, and that's it. So respect and recognizing that these kids were kids was how we ran a successful after-school program. And that leads to my next story, which is a story about an IEP. And in this case, there was a mom her daughter was in our summer camp in our after-school program, and her daughter had a diagnosis of autism. And the mom was just beside herself. An IEP was coming up. They were pretty sure they were going to try to put her on more meds, or that there was going to be some restrictive practices within her plan, and knew that I thought differently about these things and asked if I would come to the IEP. And so I went to the IEP, and the case was pretty straightforward. When the bus came in the morning to pick the daughter up for school, she would sit on the ground, and she'd have to be, picked up and put on the bus. And then when they got to the school, she'd sit on the ground again, and she'd have to be picked up and brought into the classroom, all of which is, humiliating if you think about it happening to you. And then she'd be fine in the classroom during lessons. She'd absolutely fine, involved, participating. And then when it was time to go to lunch, she'd do a sit-in again, and didn't want to go to the lunchroom, and then was fine getting on the bus to come home. I've thought of my career within working with people with intellectual disabilities, a lot of it I've seen as detective work. what are the clues here? What dots can I connect? And so I'm listening to this, and I said, well, it seems pretty clear to me that it's not the bus. She has no problem getting on the bus when it's time to go home. It's not school in general. She's fine in the classroom. Where is it? It's really all the social settings and the in-betweens, and it's all these different pieces of the day. And no one was talking about the fact that she was, I believe, 17, just turned 17. All the other 17-year-old girls who she went to school with were driving, holding hands with somebody in between classes, socializing with their friends in the lunchroom, socializing on the bus. All the things that she was denied because she was different and couldn't fully participate, or at least couldn't fully participate in the imaginations of the people around her. And so in this meeting, I said, I'd be mad too. I wouldn't want to be in the middle of all that. I wouldn't want to be constantly reminded of all the things that no one is letting me have. These fuller relationships and driving and all these other things. And so, the conversation had been, let's increase this medication, let's do this, let's do that, all of it, symptom treatment. And everyone in the room, other than the mom and maybe one other person, looked at me like I had two heads when I suggested that maybe she'd just like to be a 17-year-old girl and she hates these settings. And she's trying to tell you as best she can that she doesn't like these settings. And so, again, just this idea of recognizing that these things feel like, trauma to her. These feel like stresses, and she's trying to tell you and no one's listening. Finally, I'm going to leave you with one last story. And this is a story of a life. And so there was a young man that we'd been working with in our summer camp and after school program. And his stepmother wanted him out. At one point, I think she had even shown up at the county offices and left his luggage on the lawn in front of the county offices. She wanted him gone. He had some very self-damaging and disruptive behaviors that included some nudity and some other things that could get him in some trouble in places. He was mostly nonverbal. Most of these behaviors happened when he would be at respite care. So if he went to a group home for the weekend or a week, these behaviors would show up. He'd get himself kicked out. I went to one of his IEPs, and he was in a sheltered workshop for workforce development work, and he would do sit-ins before it was time to go. He would have disruptive behaviors while he was there, and then, of course, in the typical pattern for the standard system, the recommendation at the end of all that IEP description of everything that was all these behaviors was that he should just keep doing that and maybe do that after graduation too. So, he's showing us that he hates it, but let's make sure he does it forever. So we were given the opportunity as part of a pilot within Lancaster County, and this is 20 years ago, over 20 years ago, to create a circle of support and do person-centered planning for him. And I was asked to facilitate his circle and his person-centered plan alongside his supports coordinator. And so we gave him full participation in, what do you want for your life? Do you want to live in a group home? No, like he didn't say no, but we kind of came up with some language, some symbols, ways that he could talk to us. Sometimes we used pictures. He loved high fives. So if we said, if you like something, give us a high five. If you hate it, just look, just do that blank look, and so he did that, and we'd say, you want to live in a group home? Blank look. Do you want to live in a house? High five. Oh, okay, now we're on to something. And so we started going through, like, designing a life based on what he wanted, and we ended up. He wanted his own place, so we started going around to places that were for rent. Some landlords were not interested at all, and we moved on. But we ended up finding a beautiful row home for rent that had a landlord whose mom was a special educator, and he was completely up for having a different kind of agreement with a tenant. The young man wanted the place in his name, And so the landlord agreed to that. If the place was in his name, we were like, let's build some credit. Let's give you a history here. We put the utilities in his name, not in the name of the agency. He didn't want to live with staff, and actually there were students, college students he'd worked with at summer camp, and he wanted them to be his roommates. And so we designed a system where they would get free room and board if they lived with him and helped him get through his day. I can tell you, we had, having been someone who ran a group home for one part of his career, we had drastically lower turnover rates in this model. No one lasted less than a year, I think a year and a half as one of his roommates. It's been 22 years since we did that pilot. He still goes to dinner with those original roommates and their kids. They all have families now. They were college students then. But they were the same age he was. They took him out to things. He had a social life. All those behaviors, all those self-damaging behaviors vanished in this new living arrangement. He thrived. And it was because he was telling us through those behaviors that he hated his life. He didn't like it. And so when we gave him a life that he asked for, there was nothing to rebel against. There was no reason to do sit-ins. There was no reason to, take your clothes off in the middle of a public place. Those things vanished when he was happy. And so the context, and I'll bring it all together here so we have some time for questions. But the context here and how this all ties together, so many times in my career, what I've seen is people say that it's either that person, there's something wrong with them, or there's something about their diagnosis that is demanding more meds. And we're trying to create compliance or erase what we're calling behaviors with psychotropic medications that have side effects and damage people. And I've seen it happen. Instead of looking at ourselves, instead of looking at the way we're delivering these programs, and instead of looking at what we would want if we were on the other side of this equation, what would I want for myself? What would I want for my kids? And how do I work to get that for this person who I'm here to serve? How do I make sure that I'm not creating additional stress and trauma in a life that already had some just because of the circumstances of the person that I'm serving? And so that's, to me, that's an important part of the conversation. And so what that means in terms of thinking about trauma is that so many times within our programming, not only do we have someone who has experienced real trauma, they've experienced discrimination. In many cases, they've been asked to live somewhere separate from their family homes or where they grew up. I've worked with people whose parents passed away and they didn't understand why they couldn't stay in their family home and were suddenly put in a personal care home or a group home. Understanding that these are now, because of brain science, because of the movement to become trauma informed, these are things that we recognize as damaging, not just to a person's behavioral health, but to their physical health as well. And so my plea to everyone who's listening, who has the power to set course, to create culture within your organizations, to think about how your child who has a diagnosis is going to move through the world, to start thinking differently, to take this science, this brain science that we have now, and recognize that we don't need to re-traumatize people in order to help them, that we can design systems, we can innovate, and we can be creative as we're putting together what service and care looks like. To me, this is a pivotal moment. It's one thing to create a system and not know that it's harming people. It's another thing entirely to know that it's harming people and not take the necessary steps to change it. And so I'm asking everyone to be creative, to think about change, to take a close look at the things that you're doing, that we're all doing, and figure out, is this good for the person I'm here to serve? And how can I change it? How do I apply these lessons to the work? I also want to say an encouragement, because I know that those systems can seem daunting and big. It's hard to change things. And a lot of people hate change, right? How many times have we heard this is the way we've always done it? People created the systems that we have now. And guess what? We're people too. We can change those systems. We have the power to do that, especially when we connect with each other and we do it together. So with that, I would like to open up for any questions that people have or comments. We've got about 15 minutes. And so I'm seeing some things come through here on the Q&A. So let me just jump up here.
Dan, this is Lisa. While you're scanning, I just wanted to say thank you for those remarks. I thought they were really great. And I learned a couple of things that I'm from New Jersey. So now I feel like we have that in common. And I'm also an English major. So like there's like two things there that we have in common that I learned today. So I do see a couple of things that you can scan in the comments as we're looking at those. I like what you just said around people. We create the systems, we create our communities. And so as we're all in this shared experience of trying to claw our way out of a global pandemic in the midst of racial strife, political division, and all of the challenges that we have, how can we, I guess, harness our power as people to make that change? Like any recommendations about tactics or strategies that communities can do together to push change forward?
Thank you for that question. I am a big fan of building coalitions of the willing. So not everybody's going to be up for this. Some people aren't going to want to change. And in the kind of most pessimistic environment, I would even say some people profit from things staying exactly the way that they are. And those are going to be the folks that will actively resist change. If you're a pharmaceutical company, the last thing you want to hear is some guy talking about how there are other answers to behaviors besides psychotropic meds, and talking about, healing strategies and therapies that actually work and, that don't require drugs. So there are folks that will actively resist. But my recommendation is to find the folks who believe what you believe about being a servant leader, about care, about empathy and respect, and about putting people that we serve at the decision-making table to guide what we do. And when you can find those folks, suddenly you're not the lone crackpot at an IEP. Suddenly you're a team of folks. And so I think the work gets easier the more hands we bring to it. That's why I started with a think tank for the trauma-informed PA plan. I thought there's a difference between one guy in the governor's office saying, hey, listen to me, and a whole bunch of folks who agree that it's past time for us to think differently about trauma and chronic stress. And like I said, we couldn't have imagined that a pandemic would put an exclamation point on what we were trying to preach to people. But now what we've seen is more and more people joining the cause and being willing to speak up about how we need to change the way that we do this. So yeah, I think it's finding those other folks and moving together. There's a great proverb that says, if you want to go fast, go alone. If you want to go far, go together. And I believe in that. I see another question that came up is about the trauma of parents and caretakers. And that is absolutely part of what we talk about within HEAL PA. We call that vicarious trauma. You can get compassion fatigue as another. There's some phrases that are out there, but it is traumatizing to do the work. There are chronic stresses that come along with that. One of my children was diagnosed at a young age with a type of epilepsy, and there are stresses that come along with this caregiving. We see burnout is very high. Not just within folks who provide care to people with disabilities, but social workers and nurses. Think about our frontline first responders and our medical professionals right now in the world that we live in. Burnout, compassion fatigue is vicarious trauma. It's very real. It's also called secondary trauma. Secondary and vicarious trauma are the two most common terms for it. My concern with the world that we're in right now is there are so many overlapping traumas, and we've seen kind of ripple effects. So we've seen, for instance, the record number of overdose deaths last year, and homicides and gun violence spiking in several communities around the country. These are all sort of symptoms that also feed back into the general sense of stress and trauma that communities have and that individuals have. And so when you throw into that I'm also caring for a disabled child, or I'm caring for an aging parent, or whatever it might be, it's really important to recognize de-stressing strategies, things like breathing and deep breathing exercises. I've given you a lot of bad news today. Here's some good news. There's something called 4-7-8 breathing, where you breathe in for 4, you hold it for 7, and then you breathe out through your mouth for a count of 8. That kind of slows down your system. It kind of tells your body it's time to calm down. It's good. Things like yoga, Tai Chi, exercise in general, taking a walk outside in nature. There's a bunch of things, and as I said at the beginning, no two de-stressing or trauma treatment therapies will work the same for two different people, but find the one that works for you. Meditation is another good one, and there are apps, there are YouTube videos. If you have an Echo or one of those devices at home, you could ask it to play soothing music, or to have they have apps that will talk you through meditation. But those are the things that we know work, that kind of shut off that brainstem and put your frontal lobe back in charge. And so not just for caring for a child with a disability or for someone else, but even if you're just stressed out right now in general, these are the things that we recommend for folks. Another question that I see is, what solutions did they find in the first IEP story about the girl avoiding the bus and lunch? Unfortunately, they didn't listen to me. And so there was no solution as far as I'm concerned. They increased meds, they played around the edges, but they didn't do anything imaginative or innovative and creative around what her life looked like and helping her feel more connected and involved. One of the programs that we created at that nonprofit where we ran the after-school program and the summer program, we ran all sorts of social programs for people with disabilities. We created a program called Independent U, with a capital U at the end. And we did it to replace some of the sheltered workshop things that we saw happening, where people were kind of shuttled off, where we couldn't see them in some sheltered workshop somewhere, and we're making, a couple of bucks a week, and we were calling that workforce development. We actually would sit down with people and ask them, is there a field or a discipline that you'd like to work in? And then we would find volunteer opportunities with them. We would send a workforce coach with them, and we'd build their network, their social network, their resume. Some of them volunteered at museums and different places. One person was a greeter at Waffle House and loved just saying hi to everyone and smiling. So we found things that people like to do that could help them get out of that pattern of resisting and being labeled with behaviors, or being labeled as a difficult person, or again getting psychotropic meds. So that's how we approach those kinds of circumstances. But unfortunately for that young lady, she didn't see that at her school for the rest of her time there. There is money in the power and power in the money. I'm not sure if that's referring to my earlier statement about folks that would actively resist, but yeah, there are folks that make money off the system as it exists right now. There are people who have power within the system as it exists right now. I never saw a person resist doing something where forcing them to worked out well. It was always traumatic, both for the person and for the staff, to try and force someone physically to get onto a bus or to do something else. But this idea of some people also like being in charge. They like the power of telling somebody else what to do. I haven't encountered many of them in my career, but they're out there. So yeah, I think that there are dynamics that you have to fight against if you want to change the system, and there will be people that try and stop you. But that's why I think it's so important to have allies and to kind of build that network of support first. English majors stand up. Yes, yeah. I found one of the things that I think is powerful about being an English major is just my experience was you would read a novel And I was a slightly non-traditional student. I dropped out after a semester originally, but came back 4 years later. And I found that I'd read a novel, and the other 10 people in the class all read the same exact book, but had read a very different story in that book than I had because of their perspectives. And their perspectives helped them see things in the book that I didn't see there. And we were all correct. We all found a piece of that together. And that's also guided how I've looked at this. And that the most important person, when we're talking about somebody's life, the most important perspective to have at that table of decision making is the person themselves, whether they have a diagnosis or not. That's followed me into my anti-poverty work, but also was there in my work with people with intellectual disabilities. Going through the questions here. I have a question and would like to speak. I think that's from Angela. I'm sorry if I get your name wrong. Bicyker? I don't know if that's possible. I am ready. Someone would like to help Angela speak. While we're waiting, I'm going to keep moving through these because we only have a few minutes left.
Angela, I just promoted you to a speaker, so you should be able to unmute.
There we go.
The buttons will be at the bottom of your screen.
Good morning, Angela.
Hi. Yes, good morning. Yes, thank you, Dan. Complex trauma is real. Absolutely. And until you dig into all of the reasons why there's complex trauma, especially when you're raising a child with a disability and attempting to get a diagnosis, the money and the power and the money comes from the fact that the only services you will get, the only appropriate therapist you will find is dependent upon that money and trying to network through a system. All the while, it is this very system that is in place. And I'm not here to bash the system. The system is what the system is. It's not great. It's not perfect, but what is? But it is the piling on by the system, by the Department of Human Services, by these county programs that then terrorizes families, adding to the trauma. And then you don't even know, I mean, we could go layers back, correct? The family, their trauma that they bring to the situation, now they have a disabled adult that is feeding off of all that negative energy. Now you have a system that's piling on. That is tragic. So what my intention is, rather than ramble on, is to say, right, families, let's organize, let's strategize, let's build our own table, because we can't move forward with the way it is. While I applaud you, and I did very similar things, I started sports programs because my son couldn't get in the traditional sports programs. I networked with universities. I did what I could to solve the problem for my son and others. And here I am now at 63 years of age with a 36-year-old son who continues to be left out of the system because of his diagnosis of profound deafness, autism, intellectual disability. Nobody welcomes him. The system violates the ADA every single day. There's nothing in place for him. When I die, what happens to my son? Well, this is multiplied times thousands across the Commonwealth. So if we organize, we take what's in place by the larger power, what CMS has said, you can only do this, you can't have this and that, but you can have this, and here's the money attached to this. Well, families, let's organize, strategize, and let's do this, and then we can do this and that. Let's solve our problem. But complaining about it is not going to alleviate anything. And yes, complex trauma is only going to be alleviated when you have control, because that's one of the other big issues with complex trauma, is not having control. Correct? So here's my email address. I'll just put it out. Please share it with everybody. Olmsted, the number 4, PA@gmail.com. Olmsted, the number 4, PA@gmail.com. We're organizing, we're strategizing, and we're building our own table. Thank you.
Thank you, Angela. It is 10 o'clock. Let me say that most systems do exactly what you're talking about, in the sense that we end up with, and I've seen this in anti-poverty work as well, we end up with cookie cutter solutions because that's easier to put together than customizing and putting people at the center of making decisions for what they want with their lives and letting the money flow with the person to the solutions that we innovate around. And so working to change that is going to take all of us. It's going to take political will. It's going to take pressure. It's going to take everybody working together to say, we need personalized solutions in many sectors, not just people with intellectual disabilities and the anti-poverty work that we're talking about. And I'm happy to say that some of that work is being piloted now from the governor's office, but there's a long, long way to go. And that is the end of our time. So I just wanted to thank all of you for your time and attention today. I want to wish you a wonderful 2 days of the conference, and thank you for all that you do. I just want to say I've worked alongside a lot of folks that I'm sure are some of them might be here, but folks just like the folks that are here. And I know the work that you do and how hard it is, and I want you to know how much I appreciate it.
Well, thank you for your powerful words of wisdom and sharing your experiences with us. And we will take this with us through the rest of the conference. And so for everyone, we are on a 15-minute break, reconvene at 10:15 into either track 1 or track 2. And again, thank you, Dr. German. We would be, applauding and thanking you if we were in person, which hopefully we'll be able to gather again in person in the near future. So thank you, and enjoy the rest of your day.